Hi, I'm David Greene, CEO of the Florida Pain Network, where we connect those in pain with the best pain relievers throughout the state, including Florida pain clinics and doctors, physical therapy practices, and chiropractors. Today the topic is facet joint injections. What are they? Who gets them? How well do they work? A facet joint, and that's spelled F-A-C-E-T, is a thumbnail-sized joint that is on either side of the spine at every level going up and down. So I brought a visual aid. Here is a spinous process, which is the bump that you feel at every level on the back of the spine. Here's one, here's one. These are called transverse processes coming out on either side. Those you cannot feel. But the area where one level connects to another in the back of the spine is called a facet joint. There's one over here as well. And they can become painful from arthritis. Arthritis affects facet joints just like any other joint in the body. It has cartilage, it allows for movement, and every level brings some range of motion to your spine. So all of those facet joints add up to a very nice range of motion for your neck and low back. So the answer to facet arthritis is not surgery. Because if you have arthritis in one joint, you probably have it in 2, 3, 4, 5. And you can't just fuse all of those joints and weld them together because you'll limit the range of motion and cause future problems. So what do you do exactly when you have arthritis in a facet joint? Well, we don't have a good facet replacement, like for a knee replacement. They just don't exist yet. So the answer once again is not surgery. Pain management doctors have some excellent options for facet arthritis treatment. Now you can also have physical therapy or chiropractic treatment works really well. So you can also use Tylenol, anti-inflammatory medication, glucosamine, chondroitin sulfate can work exceptionally well too. But with regards to pain management procedures, there are 3 that I wanted to discuss. The first is called a facet joint injection, and the needle goes right into the joint. Okay, so you have the connection here and here with the facet joint, and a doctor will use a fluoroscopy, which is a real-time x-ray machine, and allows the needle to go right into that joint. And it usually includes lidocaine, a numbing medication, or Marcaine, and a steroid. And it can work exceptionally well, just like other arthritic joints in the body. It can be difficult to get into though. Like I said, it's a small joint, and with arthritis, sometimes it can be anatomically a little bit screwy with the angles that you have to use. So that's the first procedure. The second has a fancy name called a medial branch block. And that doesn't involve a needle going into the joint. It involves a needle going in the area around it. Not in, but around the joint. Okay? And then you ask, well, how is that going to help? If it doesn't go right to the source of the problem, where the arthritis is, well, the answer is it doesn't need to. The joints in our body receive sensation from little nerve endings. Okay? Without those little nerve endings, you don't feel pain. I mean, a diabetic who has a joint called the Charcot joint, they don't have those little nerve endings coming in anymore. They've died because of neuropathy. And so what you're trying to do is induce sort of a neuropathy with the medial branch block. So the doctor will inject lidocaine or Marcaine, a numbing medicine, and maybe some steroid, maybe not, in the area where those little nerve endings are, and it can deaden that pain for days, to weeks, to months. So it can A, tell the doctor whether or not that joint is causing the pain, and B, it can provide pain relief therapeutically. So what happens when it wears off? And it may wear off in a few weeks to a few months. The answer is it can be repeated. That's one option. The second option is what's called a radio frequency ablation. You can do a procedure where a needle goes into the same area where the numbing or the steroid medication went, and you can actually heat up that area and deaden the pain, deaden those little nerve endings for months. Maybe upwards of 18 to 24 months. So 1 to 2 years it can give you pain relief for. Very impressive. That's why radiofrequency ablation is one of the most popular pain procedures in the country right now. Facet injections are the most common pain management procedure performed in this country by far, because of the problem and how many levels we have that have facet joints. Okay, so there's a lot of information on our website about facet injections and everything pain related. It's a very active blog. There's also a very active YouTube channel. This is where this video is. If you're looking for a pain doctor or a chiropractor or a physical therapy clinic, if you go on FloridaPainNetwork.com, just type in your city or zip code, and there's Google Map integration that will geographically target where you are and what's available to you, the services provided, hours, insurance is taken. It's very convenient. Anyway, I'm David Greene, CEO of the Florida Pain Network. Your pain stops here.